I'm Brittany Teasdale, and I'm excited to be sitting here today with Kaitlin Thompson. Kaitlin is the director of our Center of Excellence here at Compass Health Center, where she oversees trauma and substance use programs. Kaitlin, thank you so much for taking some time to speak with me today. I know you've worked in trauma focused care across a number of different settings, and so I'd love to speak to you a little bit about your background before you came to Compass and just kind of what led you here.
Yeah, so I graduated with my MSW back in 2014 and had a number of jobs, particularly with veterans when I first started in the field. So I graduated with a specialty in substance use treatment. I have my certification in alcohol and drug counseling. And then when I started working with veterans is when I started to learn more about trauma, get specialty training in trauma, particularly through the veteran lens, but then was able to sort of expand that to civilian experiences as well. So I worked with veterans for 6 years, both in a housing setting and in a PTSD treatment setting. And then shortly after that, transitioned over to Compass, where I was the director of our trauma program in Chicago before transitioning into this role. And even before grad school, I've been working in the mental health field since 2007 in various settings, group home, residential detox. So I have quite a bit of in the field experience even prior to that social work degree.
Amazing. What about trauma and substance use specifically within the context of mental health interests you?
For substance use, it's just so intersectional with almost any mental health diagnosis. Any diagnosis that exists, there's somebody coping with it with substance use. It's just such a prevalent sort of tool that a lot of people resort to. And of course, that can lead to exacerbation of mental health symptoms or the beginning of new mental health symptoms. It's just so tightly entwined with so many people's mental health journey that it just seemed important enough for me to learn more about. And then trauma, I think once I was exposed to it, it just grabbed me to be able to see not only how trauma impacts people and their development and their growth over time in the ways that it reaches through people's lives, but then once they start their healing journey and start confronting those traumas and learning new ways to cope, sort of the transformation that I have witnessed as a clinician is just so incredible that I was hooked as far as learning more and learning the best way to treat it.
And how do you define trauma? I know, I feel like in the last number of years, trauma has definitely become, for lack of a better word, a buzzword. How do we define trauma?
Yeah, so there's a few different working definitions that I use sort of depending on the context. So, for example, the DSM, which is, the diagnostic manual that most clinicians use, PTSD or post traumatic stress disorder requires exposure to event involving threatened death, serious injury, or sexual violence. And this can be directly witnessing it happen to someone or learning about it from happening to a close friend or family member. However, I prefer to use a more expansive definition, one that includes stuff like severe psychological manipulation, neglect, consequences of oppression, things like racial trauma or chronic fear of safety for things like homelessness. So really, I prefer the expansive definition, and I think SAMHSA has a really great way of summarizing it, which is the 3E rule. So there's some sort of event that the person personally experiences as harmful or traumatic. So two people might both experience the same thing. Not a big deal for one person, but life changing for another. So that personal experience is really important. And the third E is effect, so that there's some sort of impact on their life moving forward, some sort of dysfunction, symptoms, barrier to living a full quality life. Also, just thinking about what trauma kind of looks like and feels like to an individual, I think is important too, because it is psychological and physiological. It really is an injury to the nervous system that disrupts one's sense of safety and connection. And trauma can exist on a spectrum. So there's these acute incidences, something we might think about as like a car accident that happens once versus chronic relational or developmental trauma, something that can span years and years and happens within the context of a relationship.
Okay. That's really helpful. I think that, it's so great that trauma is being talked about more in just whether it's on social media or what have you. But I think to get a really clear picture of what it is and what it can mean for different people is so helpful. What are some of the most common misconceptions that you run into about trauma?
There are still a lot of folks out there who associate even just PTSD with war veterans. And
Okay.
so a lot of people kind of have the thought, my trauma only counts if it's as severe as that. My trauma only counts if it's this wild, catastrophic thing that it matches that sort of level of violence. And so a lot of people sort of have this idea that like my trauma doesn't count. There's also a misconception that time alone will heal it or that I should be over it. So therefore, I shouldn't seek help. I should be able to do this on my own. And that if you're functioning, it's not affecting you. I can keep a full-time job. I'm taking care of my 2 kids. Clearly, I don't need help. I'm holding it all together. But meanwhile, they, might be exhausted. They might be emotionally numb, hypervigilant, not sleeping, struggling with all their interpersonal relationships. So, a lot of high functioning folks can still kind of carry the burden of untreated trauma symptoms.
And for someone like that who is, high functioning, how do they know when it's time to seek care if they are functioning in their everyday life, but like you said, it is still hard for them, but they're functioning. What are some signs that they can look out for that their loved ones can look out for?
If the day to day is just a constant battle, that is a good sign that you can use some extra support. Even if you are managing to check all the boxes by the end of the day, but it's taking everything within you and leaving little room for joy and happiness, that is a good sign that there is room for support. And if there is generally just a dissatisfaction with how you're seeing yourself and the world around you, it can be just helpful to seek some support and see if there's some room to breathe.
And where does stigma come in to these conversations? And how can certain language even prevent people from seeking care or thinking that they need it?
Yeah, stigma is rooted in so many different areas of our society. We receive messaging from our families, cultural messages, societal messages in the media. We see these things happening in the news where victims are blamed. And so stigma comes from so many different areas and essentially tells people that because they're experiencing this, there's something wrong with them, as opposed to the reality, which is they're having a typical response to an atypical situation. And so there's also this language around strength that, some people feel like asking for help or seeking treatment is a weakness or means that you don't have it all together or things like that. So I think just language around what it means to get help, what it means to be strong, what it means to have experienced trauma is all really important.
Okay, that's really helpful. And you touched on this a couple minutes ago about how trauma is something that lives in the body. Could you kind of dig a little bit deeper into that and what that means?
Yes. So a lot of times when we're talking about the sort of impact on the body, there's so many different ways this can manifest, but most of it's rooted through our autonomic nervous system. So typically when something scary is happening in the world, our body's sympathetic response allows us to run or fight and survive. So, for example, if something scary is happening, my digestive system, my immune system, my body's going to kind of shut those things down and divert that energy to my legs so that I can run really fast or fight really hard. The classic example of a mother being able to lift a car up off of her child, this like superhuman strength. This is our survival mode. This is what allows us to survive. And then after that, once we're in safety, ideally, our parasympathetic system allows us to calm back down and calm back to baseline. And for that, those other day to day processes like digestion and our immune system to kind of kick back on and return to baseline. But sometimes, especially in the face of chronic trauma, this latter process gets interrupted and the nervous system is just sort of constantly ramped up, ready for more trauma, trying to keep us safe. But over time, our body cannot be amped up, ready for a fight 24/7. And this this can start to cause dysfunction, especially if we are in a safer environment, if we are out of danger, but our body is still responding as if we're in danger. This sort of chronic stress response can lead to health problems and other sort of stressors on the body. As a result, we see a very large correlation between trauma and things like chronic stress, physical symptoms, chronic pain, fatigue, fibromyalgia, insomnia, other mental health conditions like anxiety, depression, panic disorder, things like that.
I am familiar with the book The Body Keeps the Score. That's kind of one of the more well-known books about this. Is that a book that you reference or kind of speak to as well?
Yes, I think The Body Keeps a Score is a really great glimpse into how the body is impacted by trauma. It can be a little triggering for someone who's earlier in their journey of recovery and healing. So I just do like to kind of give that sort of warning. It can be heavy, it can be activating, especially if something is resonating with your own experience. But it is a great resource to understand more about the ins and out of that sort of nervous system response.
Okay. And kind of leaning into that direction with this, we treat trauma at Compass, trauma and PTSD. We have an entire specialized program dedicated to helping folks who have experienced trauma. Could you speak about our treatment model and what makes it kind of different?
So there's a couple of pieces. One is that our program combines group therapy, individual therapy, family therapy, psychiatric evaluation, medication management, and concrete skill focused groups. And so, really addressing the whole system, what's going on biologically, what's going on within the mind, sort of the thoughts that I'm having, what's going on within our bodies. And so the modalities that we pull from are ACT, acceptance and commitment therapy, CBT, dialectical behavioral therapy, and CPT, cognitive processing therapy. And what's great about sort of the triad of these three evidence based interventions together is that there are multiple doors to healing. There are multiple ways to sort of move forward, and no one is going to find the same exact formula that works for everybody. So having a really large toolkit allows people to find what works for them and take what is most effective. And so, with that, thinking about, for example, cognitive processing therapy, there's a really heavy focus on our thoughts. What are the thoughts that I have as a result of my trauma? Are they helpful and useful to me? If not, what do I do with that? How do I make sense of that? How do I make sense of my trauma in a way that is adaptive rather than like blaming myself or beating myself up or struggling to have relationships with other because I just think everybody's out to get me, things like that. Coming back to the body, we have, dialectical behavioral therapy focuses a lot on sort of crisis intervention skills, distress tolerance, emotion regulation, and that's going to include things like grounding and mindfulness and some more of those somatic tools to help go through the body based intervention, right? So maybe my thoughts are too fast for me to keep up. Maybe that is just not where I'm at, and I want something to be more body based. We have options, right? And then ACT really focuses on a couple things building psychological flexibility, also integrating mindfulness and acceptance, and changing our relationship with the thoughts that we're having. So the three of them combined really I think, give a comprehensive roadmap for how to manage trauma symptoms. Beyond that, I'll just emphasize that Compass really values evidence based care, outcome data, and using concrete numbers to guide our interventions. So, patients on average show about 45% reduction in symptoms post treatment. And that is based on standardized, validated measures that measure PTSD symptoms, depression symptoms, anxiety symptoms. And we use these measures to really make sure we're on the right track, that patients are improving, and to adjust our treatment plan if for some reason the numbers are suggesting that they're not getting better.
And then there's that integrated component as well, right? Like you spoke to at the beginning with mental health and trauma and substance use, they can all be something that needs to be treated at the same time. And so we're able to accommodate that within our programs.
Yes, it's very rare that a patient just has siloed trauma in a bubble, nothing else going on. Often our patients are struggling with co-occurring conditions like mood disorders, anxiety, OCD, substance use. And our model really emphasizes on treating these things simultaneously rather than one before the other or sequentially. What we know is that the research suggests is that doing everything at once is the best way to prevent relapse and to decrease symptoms faster.
Okay. And what does healing from trauma really look like? Like, is it, for those who feel like I'll never heal from the trauma that I experienced or witnessed, what does that look like? What does trauma healing look like? And what does it not look like?
Healing is not erasing memories or going back to the version of yourself before trauma. It's regaining a sense of control, of purpose, and of connection. I like to say therapy doesn't make life less hard. It just makes one more confident in being able to deal with the hard parts. It's moving out of survival mode and re engaging. We often talk about how avoidance is one of the biggest symptoms of PTSD, and it also sort of perpetuates PTSD. The more we avoid things that make us nervous, the sort of smaller our life becomes, the more our symptoms sort of take over. And so we really help our patients learn how to engage with life despite anxiety, despite fear, and to live a life based on values. And that in turn then actually helps reduce symptoms.
I know we only have a few minutes left, and I want to, kind of just touch on if there are friends or family members supporting someone with trauma, what can they do to just, support them in this, help them maybe get started on a treatment path if they're not already, and what that can look like.
As someone who's a friend and family member, I totally understand the impulse to want to problem solve, right? We want to take our loved ones out of the suffering and try to fix it all for them. And that often can actually not be the best, most supportive thing. Validating people's experiences, listening to them, believing them is usually the first step, right? So if they're coming to you and they're telling you they're having a hard time, really just validating that and listening and being present and still showing up for them. Safety really comes just from the relationship, not from the specific advice or the to dos. And the other piece is just like normalizing seeking help. Treatment is not a sign of weakness, encouraging people to take a risk and ask for help can be really important as well. And then if your loved one does take the steps to get into treatment, just being by their side every step of the way. I know Compass really emphasizes the whole family system, and family education and support programming is a big piece of our treatment. All of our patients have the option to engage in family therapy. And that can be really supportive to just show that you're there with them by their side, even if you don't have all the answers. Healing really does happen in the community. Family members can be anchors, not by fixing, but by listening.
For those who are watching someone struggle with trauma or themselves, or they themselves are struggling with trauma, what happens if it does go untreated?
It looks different for everyone. And so, I definitely don't want to like prescribe the worst case scenario, but typically what we see if it is left untreated is that someone's life can become smaller and smaller and smaller. As I mentioned, one of the main symptoms is avoidance. And so people might start avoiding, the grocery store or parties or social events. And that wears down their sort of confidence to handle stress and increases the number of things they're avoiding. So, when left untreated, we just often see people's lives become small to be based more on symptom management rather than what brings them joy or purpose or meaning. And it also can really strain interpersonal relationships and make it hard for people to feel connected and loved.
Thank you for touching on that. I think that will be really helpful for some people to hear. I want to get to your work specifically and your team's work at Compass and kind of what excites you most about where Compass's trauma programs are headed and, just kind of your thoughts around that and what's exciting you.
I, not to brag, think our trauma program is really strong as it is, and we are always looking to evolve it and to grow and to improve. So we, again, are using our data collection to continue to look at the numbers and figure out what's the optimal time someone should be in treatment. What are the sort of specific ways that we can tailor each individual's experience? Additionally, we're expanding the ways that we integrate trauma and substance use, making sure that people are able to get multiple needs met in just as strong of a way, and then just collaborating through the center of excellence to advance our standards of cares and reporting across sites. So we're really building a system where trauma isn't specialized but it's standard.
Amazing. Okay, final question. What would you say to someone who has kind of been living with trauma symptoms for so long that they feel like the symptoms are kind of who they are now and there's no moving forward. What would you kind of say to that person who's struggling?
Trauma has an interesting way of sort of keeping us trapped and telling us that maybe we're too far gone or we're broken or things like that. But my message is just that trauma is treatable, that healing is possible with the right care. You don't have to live with trauma. You can start living with support.
Thank you so much. It was really nice to speak with you today and just be able to dig into your expertise and knowledge a little bit more.